everyone. My name is Skylar Palmer, and I'm a medical student at the University of Kentucky College of Medicine. Today, I'll be presenting on smartphone operating system preferences and biases in medical trainees. I collaborated on this project with Dr. Henry and Dr. Wong, and we have no disclosures at this time. And before I get started, if you wouldn't mind, just raise your hand here if you use a smartphone. Okay, that looks just about everyone. Just curious. Okay. It has been observed that younger generations have preferences towards certain smartphone operating systems. So this could be iOS and iPhones or Android used by Samsung and Google devices. Research has also suggested that personality may be associated with smartphone choice. However, the research is limited in medical trainees. It's very common for residents, fellows, and attendings to use a smartphone, as this allows access to apps like UpToDate, MD Calc, as well as to access EMR. So after considering our own experiences in training, as well as the literature, we hypothesized that smartphone biases may affect communication between peers in medical training. So the purpose of this study is to identify smartphone operating system preferences, biases, and other barriers to effective communication in medical trainees. The results of this study could be used to help prevent the effects of bias, as well as to improve training environments. We developed an IRB-approved survey assessing which smartphone operating systems were most common, why individuals picked their operating system, as well as other related smartphone behavior. We used RedCap to build the survey as well as to collect our data, and the survey was emailed to all 922 residents and fellows at our institution. The survey was composed of 28 questions that asked about demographic information, smartphone use and experience, as well as some questions regarding behavior towards users with a different type of operating system. The questions about bias and behavior had branching logic, and so we worded them specifically to the iOS users and then to the Android users. We accepted responses for 1 month, and we had a 20.5% response rate. So these graphs illustrate some aspects of the demographics of our respondents. We had responses from over 20 specialties, including surgical and medical specialties. Most respondents were between the ages of 26 to 37, which is expected given the typical timeline for residency and fellowship. The most common specialty represented was internal medicine, and some of the specialties that fell under that other category included cardiology, psychiatry, pulmonary and critical care, preventative medicine, and there were others as well. So the first question that we wanted to know was, what kind of smartphone were our residents and fellows using? We suspected that iPhone was the most common, and our results confirmed this, with 87% of respondents reporting that they used an iPhone with the iOS operating system. Our survey did allow respondents to indicate if they used a smartphone that was not iOS or Android. However, no one indicated that their smartphone was not within those two categories. We also wanted to know why trainees were picking their smartphone. These results here are a combination of the Android and iPhone users, and participants were able to pick one or more of the following choices in the graph, so they picked whatever applied to them. 70% of respondents reported that they appreciated their phone was compatible with other devices that they have. So this could be a smartwatch, tablet, laptop, etc. 56% reported that they appreciated that their family and friends had a similar device. So this suggested to us that there are certain desirable features of communication that can occur between compatible devices, and some examples that we thought of were liking and loving messages. Some other reasons included the features of the phone, applications that individuals were interested in, the cost, if it was recommended or required for work. To evaluate whether smartphones may play a role in bringing trainees together, we asked trainees whether they feel closer to those they work with when they communicate via smartphone. And this could include texting each other, talking on the phone, video chat. And this question was formatted as a Likert scale. It was clear that majority of residents and fellows do grow closer when they're communicating with each other via smartphone, as 46% agreed and 14% strongly agreed. As smartphone communication may offer an opportunity to bring trainees together, we hypothesized that some preferences and biases may be an obstacle to this. Our survey included questions that were specifically asked to each user group. And as there was a strong majority of iPhone users, we felt it was important to show the results of some key questions regarding social preferences and biases from the iPhone responses. And we had two key questions to investigate this preference and possible bias. The first question asked iPhone users, to what level do you prefer to communicate with iPhone users compared to non-iPhone users? And again, this question was formatted as a Likert scale. 24% reported that they had a moderate preference, 24% reported they had a moderately strong preference, and 15% reported they had a strong preference to communicate with iPhone users. Again, as 87% of our respondents were iPhone users, this suggested to us that there is a preference among trainees to have an iPhone as well as to communicate with iPhone users. It was also important for us to evaluate if these preferences did exist, would they influence behavior towards non-iPhone users? So the second question that we asked was, how likely are you to exclude someone from a group message because they do not have an iPhone? 24% reported they were likely to extremely likely. Now, we asked this question because group messages may be used to arrange social plans, to connect with trainees about your experience, as well as to chat on a day-to-day basis. And there are some features of iPhone group messages that are only present if everyone in the group message has an iPhone. So again, some examples include liking and loving messages. So based on these results, it's possible that some individuals could be excluded from socialization based on their smartphone. As resident cohorts and programs may be small, we can imagine how non-iPhone users could miss out on socialization. This could be unintentional, resulting from iPhone users not being aware of their preference to communicate with iPhone users, or it could be intentional exclusion from group messages. Either way, missed socialization with co-residents may have a negative impact on a trainee's experience in the program. So our results show that iOS smartphones are most commonly used at our institution. Additionally, smartphone users value compatibility with their devices as well as those that they communicate with. The results of our survey show that residents and fellows may bond when they communicate via smartphone, and iPhone users may prefer to communicate with other iPhone users. Some of these iPhone users may demonstrate bias, such as exclusion when communicating with non-iOS users, thus confirming our concern for bias. Areas for future study could include looking at programs that provide all the same type of smartphone to their residents and fellows and evaluating these attitudes. Another area for future study could be looking at these attitudes in medical students. Over the recent years, training programs have increasingly focused on wellness and culture within their programs. So with these results in mind, residency and fellowship programs may consider standardizing smartphone choice within their institution to overcome potential barriers to communication. Here are our references. It's a QR code if you want to look at it with your phone. And thank you.
Alrighty.
Have you considered Yeah, those do exist. I know, like, for example, we have student organizations that use Discord, that use GroupMe. I guess it just kind of depends on what your cohort like maybe leans towards. If a cohort of, I don't know, like pediatric residents make a group message, then perhaps that's going to be the avenue that socialization forms from. But it's definitely a way to avoid this problem.
So I don't think we're going to get iMessages in the Android side because Apple kind of uses iMessages to make sure that you buy their phone.
Mm-hmm.
So do you think that there is, I don't know, utility in residencies providing, say, Apple devices?
I think kind of what we were considering was the standardization. So maybe it doesn't have to be Apple, but they don't really have to worry about it if it's all the same type of smartphone. It seems like for us, not everyone, but 87% preferred that iPhone. So maybe if there was a resident that had an Android, maybe some additional funding being available if they wanted to get an iPhone. or just having that in the program. And maybe they have certain apps that residents like to use, so they can get that on the iPhone. But yeah, that is something that we see could be helpful to prevent this. Yeah, I know, like for myself, I wouldn't pick a residency based on this, but I know a lot of my devices kind of come together, and that's really nice for me. But there is research about that. It's like brand identity. And so Apple does have like higher brand identity compared to other smartphone choices like Android. So people are more loyal to iOS and Apple. So it does exist.
Alrighty, thank you so much.
Thank you.